There was, among the patients that I treat, cardiac rehab patients who take beta blockers. As Dr. Bradley mentioned, they're essential for heart health, but they also disrupt sleep to some degree. And there was a trial, randomized trial, where patients with beta blockers were also given melatonin, and others were just given the beta blockers. And the melatonin, in addition to the beta blockers, was very helpful to the sleep of those cardiac patients.
How effective are the dental devices?
Sorry, the question was, how effective are the dental devices? I presume you mean for sleep apnea. Yeah. Well, they're developing new devices all the time. They're more effective than they used to be. Generally speaking, what they do is there's two bite plates, an upper and lower one. They're custom made. The ones you buy over the counter generally don't work, so you have to fork out around $2,000 or $3,000 for a real one. And what they do is they have two bite plates joined by a hinge, and there's either a screw or some other mechanism that moves the jaw forward like that and pulls the tongue away from the back of the throat. They generally can be very effective in patients with relatively mild sleep apnea who are relatively thin. They don't work in people who are grossly obese and have severe sleep apnea. So there's definitely a place for them. And if you compare patient preference, if you treat a patient with mild to moderate sleep apnea with an oral appliance or with CPAP, in general, patients prefer the oral appliance. So they can be very effective. In fact, there's a dentist, Dr. Masami, who started a sleep disorders clinic in this hospital who's making these appliances right now. By the way, I just wanted to show you what our device looks like. This is the Brizo DX device that will be used in the rollout in Ontario. So it's very convenient. It's a personal device, and once you buy it, it's yours. You don't have to bring it back to the lab, so it's very convenient. Well, this is government, so it's anybody's guess. We don't really know. They made the announcement, but then now they have to have the terms of reference, and they have to select the laboratories. Presumably what they'll do is they'll have a call for applications for people who are interested in this, and they'll make some selection on basis of various criteria, but we just don't know. It's not in our hands, it's in the government's hands at the moment. I imagine it will be in the fall sometime. Yes, question?
This is to Dr. Rehab, to you. Some people swear that they can get by on 4 to 5 hours a night, like Donald Trump and other people such as him. And they seem to be able to function, whatever that means. Can people get by on 4 to 5 hours a night, and even if they don't have sleep apnea? And what are the repercussions on their day-to-day life? They seem to be functional. They seem not to regret that they don't have more sleep, and they just carry on. So, is that possible? Does that, is that true?
So the question is it possible to get by on 4 hours of sleep and function like Donald Trump? And that's the answer. You will function like Donald Trump. It's a really good question. I think we live in a society where, as they say, time is money, and we we have too many things on the go all the time. So we're looking for ways of cutting corners. I don't think sleep is the place to cut corners at all, and I think sleep studies have demonstrated there's about 1% of the population who are very fortunate and who are able to get by on about 4 to 5 hours of sleep. So there are some people who function very well. But I caution you because you don't know how well or poorly your body is functioning just based on how you feel. And a great example of it is our patients who have sleep apnea. If you ask them, how do you sleep? They will say with pride, oh, I fall asleep when my head hits the pillow. And for me, as a sleep person, that is danger. That's not normal. It takes 15 minutes for the system to wind down and for you to go into sleep. So if you're falling asleep right away, you're sleep deprived. Okay? Now, you don't know what's going on unless you go for a test. I think that's the huge benefit of the Brizo DX opportunity, is that more people can do these tests at home. I see patients every day who refuse to go to the sleep lab, whether it's because they're single moms and, you know, arranging for someone to look after their kid while they're out of the home. There's all kinds of reasons that people struggle with going to sleep labs, and yet it is so important for their health to diagnose these issues. Thank you for the question. Oh, yes, question over here. Yes, ma'am. So the question is about sleeping pills or anxiety medications like diazepam and Imovane. Do they make your sleep cycles abnormal? Well, any medicine that you take, whether it's for clinically indicated conditions or over-the-counter, affect sleep in some way or other. So it impacts non-REM or REM sleep in different ways. There are certainly people for whom sleep is very, very difficult, and among the patients I see, I try to get them off regular use of sleep medicines. But there may still be an important function for taking a medicine once a week or so if you're having real difficulty at that point, but not as a regular sleep aid. And I think the American College of Family Physicians also suggested that sleep medicines are not the first-line treatment for sleep problems. CBT for insomnia is. So that was the recommendation they put out last year. Further questions? I saw a few hands. Yep, over here, gentlemen.
With respect to the tongue sliding back and blocking the airways, is there any material difference if you sleep on your back, your stomach, or your side?
The question was, with respect to the tongue falling against the back of the throat and blocking the airway, is there any difference depending upon what position you sleep? And the answer is yes. Many people, about 25% of people with obstructive sleep apnea have it predominantly when they're on their back. And the reason is obvious. The gravity pulls the tongue against the back of the throat. So if those people sleep on their side, they may not have any sleep apnea at all. So they're treated differently. So there are commercially available shirts or belts that have cylinders of balls sewn into the back of them that will keep you off your back. And about 80% of people, these work quite well. Well, there's a company called Remedy, and you can either buy them online or there's outlets. For example, Medigas is a company that sells them a block south of here on the west side or east side of University Avenue. So you get them over the internet, you can phone them up, or you can go to a home care company and they can provide them. So about 20 to 25% of my patients with sleep apnea, I treat them not with CPAP, I treat them with a postural device. Question, this gentleman?
Yeah, just wondering what your thoughts are. I don't know if you heard about that experimental surgery that Mike Napoli had last year. Who plays for the Texas Rangers, where they broke his jawbone here and moved his jaw forward.
Yeah, it's so the question is, what is the role of maxillomandibular surgery in the treatment of sleep apnea? Well, it's difficult to say because, first of all, this is big-time surgery. Often it cannot be done in one session. They often have to do two because they have to break both the maxilla and the mandible. They have to have bone grafts to move the jaw and the upper and lower jaw forward. This is big-time surgery. There are no randomized trials showing that they work. So surgeons will tell you that they work, but they don't have the proof of it. So I have never sent any of my patients for that surgery, and I won't until they can prove beyond a shadow of a doubt that it works, because this is expensive, very time-consuming, very significant surgery. Now, the surgeon who's opened up the sleep clinic, Dr. Masami, actually does that surgery, so it is performed, but I personally wouldn't have it myself until I have more evidence that it actually works. Oh, question over here? Yeah. Well, there are, as I mentioned, there's the postural treatment, there's the oral appliances, And recently, there's a paper published showing that neural stimulation of the hypoglossal nerve. So the hypoglossal nerve is a nerve that comes from the brainstem and innervates the tongue. So when it's activated, it forces the tongue forward. And one of the devices that is made stimulates the tongue in time with breathing to move the tongue forward when you're breathing in. Now that device has been used in people with relatively severe, moderate to severe sleep apnea who failed CPAP, who can't use it. It's not available in Canada yet. It probably will be, but it's going to cost in a neighborhood of $30,000 to $40,000. And it's not that effective. So far, it only reduces the severity of sleep apnea by about 50%, which is no better than a normal appliance. So at the moment, it's semi-experimental treatment, but that's another treatment that's on the horizon. And the other things, as I mentioned before, are exercise. I mean, we've shown that exercise can improve sleep apnea. We've shown that compression stockings can improve sleep apnea. So there are alternative treatments. So what's happening is that we've gone from a one-trick pony, CPAP, to developing the understanding of what the underlying causes of sleep apnea are. In other words, the mechanisms. If we identify the mechanisms of disease, we can have specific treatments to attack each one of those mechanisms. So as I said, 20 years ago we had one treatment, now we have about 5 or 6. So it's getting better. Question over here?
Yes, do something about irregular sleeping patterns. I have a sleeping pattern, irregular every day. Sometimes sleep in the morning, sometimes sleep in the afternoon, sometimes sleep at 5 o'clock in the evening, and then 10 o'clock again I'm sleeping.
Okay.
Right. So you are a child of the 21st century, and I think all the millennials are following in your footsteps. This is a big problem. The amount of evidence that we have in terms of physiology, what does the body do when you change the sleeping time around, is that it's as bad as not sleeping in terms of metabolic functions, release of hormones. All of these things are timed, and the body, every cell in the body has a little clock, and it can measure 24 hours. But it needs the overall timekeeper, the suprachiasmatic nucleus, to tell each cell where we are in the cycle of being awake and being asleep. So when you're sleeping at different times, you're giving different signals to all the cells of your body. And after a point, they're going to say, I give up. I don't know who's in charge here, but we're just going to do our own thing. And you get what's called desynchronization. And that's not it's not a healthy phenomenon. So you put yourself at risk for many kinds of conditions later on, from high blood pressure to problems with blood sugars and so forth. So it's not ideal. Shift workers, my mom was a nurse, and she found that if you go home and sleep from 8 in the morning till noon, and then try and get a little bit of a sleep before you go in for the next night shift, that you can shift back and forth between your nighttime shift pattern and your daytime shift pattern, and your body kind of adjusts to it. But even that is probably not ideal in terms of your body functions. But this is a big challenge for all of us going forward.
Okay, I think we're going to call an end to the questions, but perhaps we can ask the presenters to stay for a few minutes if you have like some very specific questions for them over the next 5 or 10 minutes. Before you all take off for your day, I just want to acknowledge Bob Blakely and his firm Liquorlin for sponsoring our Health Innovation Series here at Toronto Rehab. We do them at least quarterly. I think we may have done 5 this year, and we try to bring you topics that are relevant, that are interesting, and that will help you manage your own health and well-being. As well, we are providing some tours of our truly spectacular, extraordinary research labs here at Toronto Rehab, and I think I see Gary, and I think I see Anthony at the back of the room, and perhaps Giovanna. Hello. So at the back of the room, if you'd like to take a tour of our labs, probably take you 25 minutes underground and the top level, penthouse level of this facility. Go check them out if you have time. Again, thank you for coming out. Thank you to our presenters. That was awesome. Thank you so much.